and good afternoon, everyone. Thank you for joining us on short notice for this update from the Health District. In the next 10 minutes or so, I just want to cover our current situation with respect to recent increases in COVID-19 and a recommendation for all people to mask up when indoors in public places, regardless of vaccination status. As you are aware, COVID-19 cases and COVID-related hospitalizations are going back up again locally, statewide, and nationwide, and we are now on our way up a fifth wave of transmission here in Snohomish County. For the week ending last Saturday, July 24, a total of 634 new cases were reported, a 20% increase from the prior week, and a 125% increase from the 280 cases reported just 4 weeks ago at our low point after the fourth wave. The rolling 2-week case rate per 100,000 residents is now at 140, placing us in CDC's high transmission risk level. And the number of COVID patients in Snohomish County hospitals has increased 50% in the past week, with now 34 active COVID hospitalizations at this moment. This largely preventable return to increasing transmission and hospitalizations is being driven by three main factors. One, stalling vaccination that leaves approximately 240,000 eligible adults uncovered countywide, in addition to the 125,000 children under 12 who are not yet eligible for vaccination. Two, reduced mask wearing by unvaccinated individuals in public and private settings. And three, the far more contagious Delta variant that now accounts for the majority of cases in the state and country. So first, if you develop any symptoms of COVID, please stay home and get tested. Don't forget about testing. Early self-isolation by symptomatic people can help reduce new infections. Breakthrough infections. This brings me to the issue of breakthrough infections. First, to define a breakthrough infection, it's a laboratory-confirmed COVID-19 infection that occurs in an individual more than 14 days after completing their 2-dose mRNA or 1-dose Johnson & Johnson vaccination. From January through June of this year, 300 of the county's 20,000 cases were breakthroughs. That's 1.5%. During the first 3 weeks of July, 200 of approximately 1,200 cases were breakthroughs. That's 15%. However, this is not unexpected, nor is it a failure of the vaccine program. All vaccines have breakthrough cases, more so as coverage of the population with a vaccine increases. It's just the intersection of high vaccination coverage and the occasional, but much less common occurrence of cases in that vaccinated population. The COVID vaccines are highly effective, but not perfect in preventing infection. No vaccine is, but their effectiveness and safety, even with the Delta variant circulating, really are enough to control COVID if we get everyone vaccinated. In the month of July, even with widespread circulation of the Delta variant, unvaccinated Snohomish County residents were about 10 times more likely than fully vaccinated residents to become a reported case of COVID or to die from COVID. Furthermore, most breakthrough infections are mild or asymptomatic, although hospitalizations and deaths can and do occur rarely among breakthrough cases. So the bottom line is that vaccination remains our #1 tool in preventing COVID and reducing its impact on our health and our lives. Yet vaccination efforts have stalled, as I said earlier. Almost 500,000 Snohomish County residents have completed and initiated vaccination. Let me restate that. Although almost 500,000 Snohomish County residents have initiated and completed vaccination, we have far to go. Nearly 250,000 adults in Snohomish County are eligible for vaccination, but have not started despite widespread availability. In the past few weeks, only about 3,000 residents per week have initiated vaccination, less than 1/2 of 1% of the population. Vaccines are now widely available and free in community pharmacies and healthcare settings. The Health District urges those of you who have not gotten vaccinated to do so as soon as possible. If you have questions or concerns about vaccine safety and effectiveness, please ask your healthcare provider and look for reliable information sources like the Health District, the Washington State Department of Health, the Centers for Disease Control and Prevention, other well-established reputable sources like the University of Washington, other leading medical research universities, Medscape, and the Mayo Clinic. Much information disseminated or forwarded on social media platforms is inaccurate or even deliberately intended to discourage vaccination and other COVID prevention measures by broadcasting false information or misrepresenting data. If you want to get vaccinated and are having a hard time getting a dose, call 425-339-5278 for help getting connected to vaccination. Or you can go on the internet to www.snohd.org/COVID vaccine. If you have been vaccinated, talk with people in your life who have not been vaccinated to let them know how it went and how you feel now that you've got it done. For those of you who are wondering about access to COVID vaccine for children under 12, remember that clinical trials remain ongoing, and experts involved in that work suggest that application for emergency use authorization in children would occur at some point late in this year or early next year, with CDC recommendations for use of that vaccine to follow shortly after that. Many people are asking about booster doses or additional doses for those groups known not to respond as well to vaccination as others. For example, people being treated for blood cancers or people taking strong immune suppressants for autoimmune disease. CDC's Advisory Committee on Immunization Practices has met twice on this issue in the past month alone to review data addressing antibody levels, disease rates, and disease severity in these and other groups. On both occasions, they have found that insufficient data exists on both effectiveness and safety of an additional dose in this population to warrant making a recommendation at this time for an extra dose. CDC continues to monitor vaccine safety, antibody levels, and effectiveness in these populations and waits for manufacturer applications to the FDA to extend the emergency use authorization for this specific purpose. Then they will reconsider the matter after that. If information comes out that additional doses are needed or recommended, we will share that information with you right away. I want to highlight, at the current time, patients who get the Moderna or Pfizer vaccines need only 2 doses, and patients who get the Johnson & Johnson vaccine need only 1 dose. We ask that people who receive the COVID-19 vaccine and have completed those schedules do not ask your provider for an additional dose of vaccine until CDC's evidence-based recommendations support doing so. The Washington State Department of Health has also warned vaccine providers who administer extra doses to patients that they are using the vaccine outside of its emergency use authorization and are violating the vaccine provider agreement with the department. Next, I want to cover mask wearing and preventing transmission of COVID. Despite occasional views to the contrary, the overwhelming majority of data from experimental and real-world settings shows the safety and effectiveness of cloth face masks in reducing airborne transmission of COVID. It is not a coincidence that the recent increase in cases is associated with reduced practice of prevention measures in the community, including reduced adherence to the state's ongoing requirement that unvaccinated people wear masks in indoor public places like grocery, retail, restaurant, entertainment, and related settings. Furthermore, masking remains required for all of us, vaccinated or not, in healthcare settings, public transportation, schools, jails, and homeless shelters. Many, if not most, business owners have been unable or unwilling to confirm vaccination status and to ensure mask wearing by unvaccinated people for the safety of others in that space. Given the Delta variant, the incomplete vaccination effort I've mentioned above, and rising cases and hospitalizations, this is only more of a concern in the present moment. The most straightforward way to verify that all unvaccinated people are wearing a mask in such settings is for everyone to wear a mask in those settings. This also helps protect the 240,000 still unvaccinated adults and 125,000 children under 12 who are not yet eligible to be vaccinated in Snohomish County. Consequently, together with other health officers in the region, I recommend that we all wear a mask when we go to indoor public places, regardless of whether we're vaccinated or not, and especially where the vaccination status of those around you is unknown. This is based on our best public health advice to protect you, your family, and our communities. This step can help reduce the risk of COVID to the public, including customers and workers, and help stem the increase in COVID cases and hospitalizations. It can also decrease the spread of the highly contagious Delta variant. Please note, this is a recommendation, not a requirement, but you should know that we don't take it lightly and wouldn't make the recommendation if we didn't think it was needed. I encourage proprietors and organizers in such public settings to support the recommendation, especially if they do not have a robust system in place for ensuring that all unvaccinated staff and patrons present in the building are masked. But mostly, I'm counting on each of you to see the benefit and wisdom in this. It's not expensive, it's not difficult, it protects and reassures others, and it also provides additional protection to you, the wearer, even if you're already vaccinated. I realize this change in recommendations may be confusing or frustrating to many of you. Fully vaccinated people may ask, I got vaccinated, why do I have to pay the price for others not getting vaccinated? That is frustrating and disappointing. I don't like having to make frustrating or disappointing recommendations, especially ones that imply things are sliding backwards. But things are sliding backwards. The reality is that a higher price can and likely will be paid if we do not rally and up our game on masking in public places now. The University of Washington's Institute for Health Metrics and Evaluation predicts that if universal masking is adopted right away in public settings, 800 to 1,300 additional deaths in Washington state can be prevented by November 1. That means roughly 100 lives saved, hundreds more hospitalizations, and thousands more cases prevented right here in Snohomish County. We can do this. Last, a word about ventilation. Ventilation cannot be understated as both a threat and an opportunity for preventing COVID transmission. COVID floats in the air attached to tiny invisible droplets that come out of us when we cough or sneeze, but also when we speak or even breathe. This is the main way COVID spreads between people, through the air. Good ventilation dilutes the virus and blows it away. Poor ventilation leaves it hanging there for all of us to breathe in. So open windows and where applicable, use HVAC systems to filter and bring fresh air in to remove COVID clouds from the air we breathe and blow them outside. It's one of the many layers in our prevention strategies that begins with vaccination and mask wearing and includes things like hand washing, ventilation, and trying to stay spread out when you're indoors. So with that, I'll turn it back to you, Carrie.
Thank you, Dr. Spitters. And we do have some questions that have come in by chat. The first question is, if we're seeing increases like this in the summer, how much risk are we at of experiencing another wave in the fall and winter when more people gather indoors?
Well, I'd say let's take one wave at a time, and if we can stem this one and get the more thorough vaccination done before, during, and after that, maybe we can avoid yet another wave in the fall or winter. Conversely, if we don't do a good job right now of preventing transmission and getting more people vaccinated. What's going on now could extend into the fall and winter.
The second question we have, if cases continue to rise after recommending masking, could the county move to a mask mandate?
Well, you know, as I said, we don't make this recommendation lightly, and our interest is in seeing interest in people and businesses, enterprises taking these actions voluntarily to achieve this end. I think if we continue to see increasing cases and hospitalizations, I think we would look to our state partners to strengthen the will behind this effort that we're trying to get started here in these counties around Puget Sound.
How frustrating is it that people are still not getting vaccinated by choice? And how do you plan to reach them and get them to roll up their shirt sleeves?
Well, as I've said, you know, I think that I understand many people, there's a variety of reasons that people are not yet vaccinated. Some of them relate to concerns about safety of the vaccine, about effectiveness. Those, you know, we try to dispel with facts and education, as the very facts I mentioned earlier. Again, you know, and even with these variants circulating, just in the past 3 weeks, with most of the COVID in the county being due to Delta, which probably does cause a few more breakthrough cases, we're still seeing tremendous protection, 10 times less likely to become a case, 10 times less likely to die from COVID if you're vaccinated. So those are the facts, but at some point, you know, me echoing facts doesn't have traction, and where people really can get reassurance if they're concerned is from their own healthcare provider, from trusted people in their community, and from trusted sources on the internet. You know, so I would say the first person to go to is your healthcare provider, to talk to them about it, see what they think, and talk to other people in your life who have been vaccinated. As I said earlier, for those of us who have been vaccinated and have people we care about in our life who are unvaccinated, tell them your story. Tell them the truth. You know, what it was like and what your side effects were and how you feel now that you've been vaccinated. Then there's another group of people who are interested but have, you know, trouble getting there for logistical reasons. And the health district continues its efforts to try to reach populations or groups of people who are having a hard time getting connected to vaccination. And so that work will be ongoing. But a lot of this is not something I think mass vaccination clinics like we've been operating up through June can address. It's really more one-on-one patient, healthcare provider, patient, or, you know, people, friends, family members, sharing stories, getting educated, and seeing if we can move the needle a little bit further from this 70% of eligibles getting started more toward 90%.
Is there any information or data on unvaccinated individuals who already had COVID and may have antibodies getting reinfected?
Well, reinfections do occur after natural infection, but they are exceedingly rare. In a report from the state health department, there are only 2 what I call truly laboratory confirmed cases. There are many people, probably on the order of a dozen or 2 dozen. I don't have the exact number in the state, who have had 2 positive tests months and months and months apart, you know, who initially were positive and then had another illness and a positive result. Now, sometimes that can be due to the parts of the virus, the RNA, the genetic code of the virus still hanging around, even though it's not multiplying and causing that second illness. So the ultimate confirmation is when we have the early specimen and the late specimen, and they do typing, strain typing on the early one and the late one, and they show that those are different strains. And when that's been done, there's only been a couple of those in the state. I'm sure there's been more that haven't been detected, but this is a very rare thing. And it supports a lot of the laboratory science being reported in the medical literature that naturally acquired immunity and vaccine acquired immunity persists for at least 6 to 12 months in the vast majority of people, if not longer.
And what should parents with kids who are 11 and under do to protect their kids? Are we seeing more cases of 11 and under contracting COVID, or specifically the Delta variant?
Well, when I looked at the data last week, up through the end of June for the entire pandemic, children under 15, that's the age cut we use, so kids 0 to 14 accounted for 10% of cases. That's up a little bit in the last month, 15%. But some of that also that increase might reflect that testing was less available for kids earlier in the pandemic, and now it's more available. But there's probably been an uptick. Certainly, most of the cases continue to be young adults in the 20 to 49 age group. Most of the hospitalizations are in the 40 to 59 age group, and we are seeing cases in younger children. What can be done to protect them? Well, one, having everyone around them in the household vaccinated that is eligible. Two, when they are together indoors in public or quasi-public settings, gatherings indoors with people outside the household, put a mask on. That's not a requirement, but it is a recommendation. It is a requirement for unvaccinated people of all ages, in indoor public settings to wear a mask. So continue doing that. And, then we'll try to make our way through to the time, probably some point early in 2022, when younger children are eligible. In the meantime, I think just those general common sense recommendations, as well as following the school's guidance regarding prevention measures when school gets back in the fall.
And our next question echoes the previous one, but they note that they're vaccinated and wore their masks this weekend, but still see a lot of people who are not wearing masks. How do you convince people to get vaccinated?
Well, that's the magic question, right? I mean, we've been here more or less weekly for a year and a half, with about 80% of that time, 90% of that time with universal mask recommendations. So it's difficult, but I think we just try to encourage and keep doing it, both in settings like this, where I'm communicating with you with your readers and listeners and watchers, and then all of us in our private lives with the people whom we can touch, and just have a conversation. I personally am less convinced about the value of efforts to convince people, because that implies some level of coercion, as opposed to just trying to educate people and help them make the best choices they can for themselves, for their families, and for the community that they live in.
And we have one more question in the chat. So many people who have already had the virus do not want to get vaccinated because they think they already have immunity and protection. What do you say to them? Should they get vaccinated, and why?
Well, yes, current recommendations from the Centers for Disease Control Advisory Committee on Immunizations recommend vaccination for both people who have not had COVID as well as those who have had COVID. One of the findings from the medical research that's been done around vaccination is that while immunity acquired from natural infection does appear to last in the vast majority of people, that they look for it in up to a year or more. Now we'll keep counting, but that infection acquired immunity is durable. The breadth of it, meaning its diversity and ability to pick up the variants, is not as good as vaccine-induced immunity. And so the people who have, when you take the serum, you take blood, you take the cells out, and then you take the proteins that are in there, they're antibodies, and you put those up against the variants, people who are vaccinated tend to have stronger antibody reactions to the variants than do people who have antibodies from natural infection. Also, when you've had natural infection and then you get the COVID vaccine, you get a big boost in those antibody levels, and then probably all the other elements of the immune system that are not just the antibodies. And so it's kind of like filling your tank up, and it's going to take you a lot further down the road. We still don't know how far down, but here we are at almost over 6 months for the start of the vaccination effort, over a year for people who've had natural infection. So the immunity does appear to be long lasting, but if you've had the infection and you get the vaccine, you're going to have more ability to handle these variants. That's what the science says, and I think that's part of the rationale behind the recommendations for its use. There are no concerns reported that we've seen about safety of the vaccine, like safety problems resulting from like more, allergic reactions or other bad reactions in people who have had previous COVID disease when they get vaccinated. They seem to have the same experience as everyone else.
Thank you. And that is all the questions we have in the chat. Thank you so much, Dr. Spitters, and thank you to everyone who joined us this afternoon. We will go ahead and wrap up, and we'll be in touch with any future media availabilities.